And a very good morning. Welcome back. This is Rhema Brekky. It's that time of the month, of course. We are joined by our very special regular guest, Dr Clara Chu from Life Medical Centre. Now, we are doing a little bit of a different thing this morning. We are doing a Zoom meeting, so if it sounds a little bit different, that's because it is. We like to try some new things here at the studios every now and then. Dr Clara, welcome along.
Thanks for having me. Good to be back.
And look, it is a huge month health-wise, so let's jump right into it. We've got a couple of things to talk about this morning, Movember being one of them because it is the month of November, and also National Cervical Cancer Awareness Month, a couple of very, very big topics. So let's get into it. Firstly, what is Movember?
Yeah, so Movember was started in 2003 by two friends who were meeting up for a quiet beer in Melbourne. They were having a chat about fashion trends and joked about bringing back the mustache as a bit of a trend. And the two of them decided to talk their mates into also growing a mo. And so all of this was inspired by a friend's mother, who was fundraising for breast cancer. And so then they decided to make the campaign about men's health and prostate cancer.
Wow, going after two birds with one stone there by the sounds of that. Well done to the lads. Now, what are the areas of men's health that Movember focuses on?
Movember focuses on mental health and suicide prevention, as well as prostate cancer and testicular cancer.
Sure. Now, what are some of the current stats in Australia concerning mental health and suicide prevention? Because they are huge topics, prostate cancer and testicular cancer as well.
Yeah, so look, let's start with mental health and suicide. Globally, on average, one man dies by suicide every minute of every day.
Wow.
And if that piece of stat didn't alarm you, then 3 out of 4 suicides committed in Australia are by men. So, yeah, that ought to concern us around, the mental health of men and what we're doing about it.
Mm-hmm.
And then in terms of prostate cancer, 1 in 6 Australian men will be diagnosed with prostate cancer in their lifetime. And then finally, with testicular cancer, it's not a common cancer, but it's the second most common cancer in young men aged between 20 to 39. And that's excluding non-melanoma skin cancers. These are stats from last year. It's estimated that 964 new cases of testicular cancer would have been diagnosed in Australia last year. So, these are things that do affect people, and and no doubt at some point our listeners would be impacted by these.
Sure. Now, what are some of the signs and symptoms associated with prostate and testicular cancer? Because obviously people want to know what is going on down there. So I guess to get a bit of a heads up for what is happening in the early stages.
Yeah, in the early stages, prostate cancer may not show any symptoms at all. But if you were to get symptoms, some of them can include difficulty passing urine, a slow or interrupted flow, needing to go frequently, including at night, or even some incontinence. And then by the time you get to sort of more advanced prostate cancer, then people can start noticing blood in their urine, pain when they're passing water, and also just lower back or pelvic pain. So now the confusing thing here is that these symptoms are also found in men who may have a condition called benign prostatic hyperplasia, which is a common non-cancerous enlargement of the prostate gland. So it can be a bit tricky to tell the difference between the two. And then with testicular cancer, there may be no symptoms. In fact, the most common symptom is probably a painless swelling or a lump in a testicle, or a change in the size or in the shape.
Sure. And I guess the important thing for us to know this morning is, how do you screen for these types of cancers?
Yes. So the most common test is a blood test checking for the prostate-specific antigen, or PSA for short. The PSA measures the level of this particular protein in your blood that comes from the prostate. It doesn't specifically test for cancer, though. Mm-hmm. So because virtually all of the PSA is produced by the prostate gland, we know that the normal range depends on your age, and obviously if a PSA is found to be above the typical range, then it may indicate the possibility of prostate cancer. But 2/3 of cases of elevated PSA are actually due to non-cancerous conditions, such as prostatitis, which is an inflammation of the prostate, or the benign hypertrophy of the prostate, which we mentioned earlier.
Sure.
And then in terms of testicular cancer, the best screening test is to check yourself in the shower by rolling each ball between your thumb and your fingers, looking for lumps, looking for pain, swelling, or any kind of firmness that shouldn't be there.
Absolutely. And now, how often should men get tested?
A controversial question.
Right.
So if you have no symptoms of prostate cancer and are thinking about having a PSA test, you should ask your doctor about the risks and benefits. The reason being that while some studies suggest that PSA testing reduces mortality on a population basis, the test does pick up a large number of cancers that would have caused no symptoms or harm in the patient. So this is also called overdiagnosis. And listeners might ask, well, what's the problem with overdiagnosing a cancer? The overdiagnosis of prostate cancer can lead to unnecessary treatments that have side effects that are not terribly desirable, like problems with sexual function, urinary incontinence, and also bowel problems. And so, it's important to balance the potential benefits of detecting a prostate cancer early versus the risk that detection and treatment may not be necessary at all. Now, taking note also that prostate cancer is a very slow growing cancer and tends to be something that elderly men die with rather than die of. So it's a bit of a tricky one because the treatment may affect your lifestyle, but it can also save your life. And so it's very much based on a case-by-case basis as to what's the best thing to do.
Yeah, 100%. Now, how can people support Movember for this year?
Yeah, so the Movember website has a number of different ideas of how you can fundraise for this cause. Obvious one, you can grow a mustache. If you like the opportunity to use your body more, you can run or walk 60 kilometers over the month. That's 60 kilometers for the 60 men that we lose to suicide every hour. Each hour, every hour across the world. If hanging out with your mates is more your thing, then get a crew together, do something fun and easy that you'll enjoy together and do some fundraising at the same time. Or you can create your own challenge for the month.
Yep, sounds good to me. Now, so for more details about Movember and fundraising ideas, simply go to AU, or you can probably just look at that one and do a quick Google search, au.movember.com. That's au.movember.com. We are chatting with our resident medico, Dr. Clara Chu. She is with us over Zoom this morning here in the studios. We'll take a quick break and we'll be back having a chat about National Cervical Cancer Awareness Month right after this. And a very good morning. Welcome back. We are joined via Zoom this morning, something different for us here in the studios. Our resident medico, Dr. Clara Chu, is chatting to us about National Cervical Cancer Awareness Month. Now, Dr. Clara, what are the dates for National Cervical Cancer Awareness Month for here in Australia in 2023?
Yeah, so while it is National Cervical Cancer Awareness Month, there is a particular week that's going to have its focus. And so that's going to be from next Monday, the 13th of November, to all week until the 19th on Sunday. Its aim is to build on the World Health Organization's vision of a world where cervical cancer is eliminated as a public health problem by 2030.
Yeah, wow, what a goal that is. Now, how prevalent is cervical cancer in Australia? We hear a lot about it, but some stats this morning would be very handy for our listeners.
Yeah, so last year, 2022, it was estimated that 942 new cases of cervical cancer was diagnosed in Australia. So roughly a female has a 1 in 180 risk of being diagnosed with cervical cancer by the age of 85. Having said all that, Australian rates of cervical cancer incidence and death are amongst the lowest in the world. And this is largely because of our very successful National Cervical Screening Program, which was introduced back in 1991.
Yeah, that is some very good news for sure. Now, talking about that, there has been some changes in cervical cancer screening in the past few years. Can you tell us a little bit more about them?
Yeah, so the cervical screening test replaced the Pap test back in 2017. We expect that this test will protect up to 30% more people despite screening every 5 years instead of 2. So you might ask, how's that going to work? The reason is that the cervical screening test actually looks for human papillomavirus, or HPV, which is a common infection that is passed on during sexual activity. So it's a virus that can lead to cell changes in the cervix, which can then become cancer. So without HPV, it's very difficult to develop cervical cancer, in other words. Now, since that discovery, an HPV vaccine has become available. Currently, all of our school-age students in Year 7 is eligible to receive one of these vaccines, and it protects against up to 9 types of HPV, including those that cause around 70% of the cervical cancers. So now, since the HPV vaccine doesn't protect against all types of cervical HPV that can cause cervical cancer, vaccinated people still need to have regular cervical screenings. Now, as of July last year, the government has made available a self-collection option as a part of the National Cervical Screening Program to all people with a cervix who are aged between 25 and 74 and who have ever been sexually active. So this is generally available to those who've never had any abnormalities in the previous screening test and currently don't have any symptoms of concern. So this change will hopefully decrease the barriers around having a cervical screening test, like feeling embarrassed, the fact that it's pretty uncomfortable, and offer empowerment to people to screen themselves.
Yep, absolutely. It's times like these, I thank the Lord I was born a man. I mean, we have our own issues, but I'm so glad to be in this position at the moment. Now, is a self-collected sample as effective as a sample taken by the GP?
Yeah, so look, when a GP takes a sample for cervical screening, they are collecting a sample of cells from your cervix. And if a patient takes their own sample via self-collection, they're collecting cells from their vagina. Now, HPV can be found just as well in both cells from the cervix and cells from the vagina. These samples both get tested for the presence of HPV, similar to a COVID test. And so, we're all pretty familiar with a COVID test. And so if HPV is found on a self-collected sample, the patient will need to go back to their GP to have a sample of cervical cells collected to see if there are any abnormal changes to the cervix. Now, one of the most common questions I get asked regarding this newer way of screening is, hey, is a self-collected test just as accurate as the one that the GP does? And anecdotally, I and other GPs I know have had patients who collected their own samples which have returned positive for HPV. So I have confidence that if the test is performed correctly and as per instruction, it can pick up HPV just as effectively as the conventional test done by the GP.
Yeah, look, I mean, both types of testing, critically important, that is for sure. Now, what do women need to do to organise, say, a self-collection test?
Yeah, so anyone who's due for a cervical screening test should visit their GP. Their GP will then discuss with you whether your test should be collected by a doctor or nurse or whether it can be a self-collected test. They will then give you a take-home pack with written instructions and the swab, which you can then do in the privacy of your own home and then return to the pathology collection centre.
Yep, and that probably will, I think, help a lot more women to get on board and really do the testing more often too. Now, any final words to encourage our listeners this morning to get a cervical screening test?
Yeah, I have 2 things I like to say to finish off our conversation. So firstly is if you're not sure when you last had a cervical screening test or a pap smear, please go and see your GP. We have access to the National Cervical Screening Register through a very secure portal. And with your permission, we're able to look up for you whether you're due for a test or not. Now, if it's been at least 57 months, so it's a bit cumbersome, you're like, what's 57 months? It's 3 months short of 5 years. So if it's been 3 months short of 5 years of your last test, you'd be eligible for a test that would be bulk billed under Medicare. And secondly, many years ago, I was doing some training at the sexual health clinic at Gosford Hospital, and I had a very wise mentor there who said to me, every woman has one cervix, brackets generally. It is their job to look after it. So go and make sure that you get your cervical screening done and that it's up to date.
Yep, absolutely. Very wise words there to finish off this morning. Dr. Clara Chu, as always, it's been a great privilege and a pleasure having a chat with you this morning. A couple of very, very big issues indeed. Today we've covered National Cervical Cancer Awareness Month and, of course, Movember. So get on board with those things there. Get yourselves tested for sure and keep up to date with your health. This is Rhema Brekky. We'll be right back with more after this.